Hello, dog lovers. Welcome everyone to the Natural Pain Relief Masterclass brought to you by Wag Out Loud. And my name is Krista, and I am the host of the Wag Out Loud podcast. It's a weekly show where we are obsessed with sharing information with other dog lovers so they can make well informed decisions for their dog's health and well being. And if you are not part of our Wag Out Loud Unleashed community, I highly recommend that you check it out so that you can be part of more events like this one and get to hear firsthand from experts in the field of canine health and nutrition. And being a member is absolutely free for now for current members, but there will be a membership fee for new members in the near future. So I would take advantage of that now. And you can learn more about the Wag Out Loud podcast, our community, partner products, resources, and more by going to wagoutloud.com. And if you're new to this Crowdcast platform that we're using, I want to quickly point out some of the great features so that we can have the best experience possible. And since this is a live video stream, to get the best internet connectivity, it's best to shut down any other windows that you might currently have open. So let's start with, you'll see a link at the bottom of your screen and it's labeled polls. And if you can go in there now and answer the question that we have there for you, so we can get an idea of how many of you have sought out any of the treatments that we will be discussing today. So if you could go into polls at the bottom of your screen and answer that, that would be great. And it's all coming in real time. So far, yes, we have one yes that people have tried cold laser, acupuncture, or chiropractic. We have two yeses. We have one no. So keep those coming in. Just wanted to show you that function. And then next, you'll see on the right-hand side, in the lower right-hand corner, it says say something nice. And this is not where we're going to put our questions, but instead, this is where you can comment. So let's try it out. If you could just say hello in the chat and let us know where you're from. As people are doing that, you'll see in the middle of your screen at the bottom, ask a question link. And that is where we would love for you guys to ask your questions. And it's really important because when you put your question in there, others can see what you're asking. And since we only have 90 minutes, we want to serve everyone. So we'll be answering the most upvoted questions. So be sure to tag the ones that most interest you. Of course, you would like to hear your question answered as well, but that's where you would go. So bottom middle, ask a question. And let's get started. So our Wag Out Loud Unleashed Communities theme is that on this month, we are focusing on holistic and alternative treatments. So I am so honored to have our experts with us today to talk about the life-changing treatments of laser therapy, acupuncture, and chiropractic. And these doctors are amazing at what they do. And we're so excited to share some of the great information with all of you today. Again, we're talking about natural remedies to relieve pain in our dogs. And as dog parents, we have all been there. We know our dogs well enough that we suspect when something is wrong and when we see changes in their behavior. So if you notice signs that your dog is in pain, you should take action immediately because they've most likely been in pain for a while, but are only now feeling it enough to show the overwhelm and the outward signs. So I would like to thank all of our experts that are joining us today. It's such an honor to have each of you here, and we're going to have each expert take about 20 minutes to present And then we're going to take questions after their session. And we're going to start with Dr. Tori Countner, and she's going to cover cold laser. Then Dr. Katie Woodley will speak on acupuncture. And lastly, Dr. Alicia Barnes will chat about chiropractic. So again, be sure to ask your questions using the Ask a Question link and upvote on other people's questions if you're also intrigued to find out those answers too. So we've got people here. We've got Kelly, and you're from Washington. Yay. Then we have Fort Collins also represented here today. I know that Dr. Katie Woodley and Dr. Alicia Barnes are both from Fort Collins, Colorado. And Dr. Tori is from California, San Diego area. So it is great to have you all here today. Without further ado, Dr. Tori Countner, let's start with you. If you could please introduce yourself and share with everyone why you like treating patients with cold laser therapy.
Sure. I'm Tori, Dr. Tori, and I'm from the Balanced Pet Vet. I love cold laser therapy because it's definitely a non-invasive way to get our pets to feel a lot better. It can decrease inflammation. It can help with swelling, all of that. So I apologize. I'm having technical difficulties with my computer, of course. I'm not very technically advanced. So I had a whole PowerPoint presentation set for you guys, but it has not, it's not available. So Krista, I'm just going to jump right into it if that's okay. Or did you want to introduce everybody else?
Nope, you go for it. This is your session.
Great. So I use laser therapy, which is also called cold laser or photobiomodulation or low-level laser light therapy. So that's a mouthful to say, but it's basically wavelengths that penetrate into the tissues, into the skin, down into the cells where it causes a reaction to help heal and help any damaged tissues or cells. So basically, if the cells absorb the light, which causes a cascade of interactions that help the healing process. And cold laser, it's kind of a misnomer because it's basically like a wavelength of light, but it's pretty warm. So it's not as hot as surgical lasers, but it gets through the tissue, gets through the skin and the underlying tissues to treat the cells. So I use a class 4 laser, and that basically has higher watts, so just a higher power, so I can treat these areas in a good amount of time. So a couple minutes versus an hour if we were using a lower class of laser. So during laser therapy, infrared laser light interacts with the tissues at the cellular level, like I said, and metabolic activity increases within the cell, basically improving the transport of nutrients, and it initiates the process of production of ATP that leads to a cascade of benefits, increasing cellular function and health. So complicated scientific, long story short, like nitrous oxide, which vasodilates, help with circulation. Why do we care about circulation? Because that brings in nutrients and it takes out waste products. So that's a huge benefit. It also has production of reactive oxygen, and that affects the signaling pathways. So growth factors production, cell proliferation, motility, all of that. It's super, super helpful in animals that are needing some healing. So what are the advantages of laser therapy? Why should we use this other than just kind of the cellular level? Like, why is it important for our animals? So first off, it's anti-inflammatory. So it reduces the pro-inflammatory mediators. So this light penetrates the tissue, gets into the cells, specifically gets into the mitochondria and causes, again, this cascade of benefits. It helps with analgesia, so pain relief. Studies have been shown that it causes a release of endorphins from the cell and goes to that trigger point right there where you're treating, and also systemically, which is amazing. And it decreases pain receptors. So if you've ever bumped your elbow or your arm and you immediately go to rub it, that's kind of desensitization or decreasing those pain receptors that are causing the signaling to say, hey, this area is in pain. So it decreases that, which is wonderful. It also helps with tissue repair. So it increases energy to the cells. And again, that helps bring in nutrients, take out waste products, and increases the time of healing. It helps with nerve function. So our dogs with neurologic issues or nerve degeneration, it basically helps, again, keep those nerves stimulated and getting nutrients to them and oxygenating them and bringing good stuff, taking away the bad stuff. Immunoregulation. So it stimulates immunoglobulins, neutrophils, and lymphocytes. So all of that, all of our immune system cells like come to that point and just help kind of clean up that area and heal that area. Wound healing. So like burns, scrapes, other abrasions, that again helps. The infrared light helps stimulate collagen development. So that will help with, again, healing of the wound and the tissue in there. And it reduces scar tissue, which is super important because scar tissue has like fibrous tissue that can really adhere to the underlying skin, muscles, all of that. So it basically reduces that fibrous tissue formation. And I'll show you guys a picture. Again, I apologize for this, but this is me treating Jonah, a golden retriever. He's about 13 years old, and I am treating this, the elbow area with my contact bulb right there. He has hip dysplasia, but he puts so much weight on his front limbs that he definitely has caused his elbows to become arthritic. So I'm treating him with this contact bulb on his arthritic elbows there. He's wearing protective eyeglasses. I'm wearing protective eyeglasses as well. So that is important to make sure that we're safe. So what type of injuries do I treat? I mainly treat arthritis. I see so many old arthritic dogs. It's so helpful. Arthritis is that bone-on-bone contact. It just causes inflammation. It causes pain. So for arthritic dogs, it decreases that inflammation, stops that that pain signaling, kind of desensitizes those pain receptors and those mediators. So that also helps as well. Neurologic disorders, like I talked about, kind of those neurologic diseases that those nerves need kind of a little bit of a kick and regeneration. Degenerative joint disease, same thing as arthritis, essentially how it's treated. Burns and wounds. I saw a dog 2 years ago, I believe, that his back was burned from being on a heating pad after he had surgery to remove bladder stones. That was a little bit heartbreaking, but through like bandage changes, ointment, and laser therapy, we helped with the wound healing, with the burn healing, but also decreasing that like fibrous tissue underneath, because it was right along his back and I didn't want him to develop that, to develop any like fibrous tissue underneath that scar. Ear infections and dermatitis. Ear infections, this is a big one. So their canals can get really, really thick and really inflamed. And by coming in, I would say like every other day, I try to get my clients in every day, but if we can open up those ear canals, then we can clean them out and we can put in medications. So that is super important in decreasing inflammation in those ear canals. Chronic pain, again, the arthritis, the creaky bones, the back spasms, the tight muscles, we can really help with that. Post-op healing, so I see a lot of TPLOs. It just helps with getting them feeling better and getting them using that joint more, and just helps with that whole healing process. Intervertebral disc disease, that's another one. Again, just not only just treating the specific disease, but all the muscles and all the ligaments and everything that's supporting that that specific disease is also being treated, because they're putting their weight on other muscles and using everything that that also needs healing. Stomatitis for cats, so they have basically, it's like inflammation of their mouth, and they have like ulcers and just terrible inflammation. So if you can get a cat to sit for you for, I mean, ideally twice a week, it's super, super helpful. Acrylic dermatitis or those lick granulomas, that is wonderful too, just because it helps with that healing process. It stops that whole cycle of pain, of itchiness. And so we can get those to heal. It's not quick, but we can get those to heal, which sometimes it's just impossible to get those to heal. And then again, pain or acute pain. So they went to the dog park and they tweaked something, and it's, pretty acute or pretty quickly onset. So what does the session look like? So first sorry guys. So first I'm either mobile or I'm in a clinic, and either way, I always talk to the owners and get the dogs used to me a little bit. And then I do an examination, a full body examination, and I do acupuncture also. So I place acupuncture needles and I perform laser therapy while the needles are in place. It's a great tool if the animals also just don't love acupuncture and they shake out the needles right away. And so I focus on one body part at a time. So my laser is great because I can say, it's a 60-pound dog with a thick hair coat, but it's a kind of a light hair coat, and I'm treating the stifle area. And so it's really nice. I don't have to do any math, but they'll input how many, joules and watts and everything needed to treat that area. So that'll take a few minutes. And so I just focus on that one body part. And each region takes anywhere from like 1 minute to 7 minutes. A tiny Chihuahua isn't the same as a Great Dane, so their knees are going to be vastly different in size and thickness and shape. They usually feel, the animals usually feel just kind of a warming, and they don't really react to that unless it's a little bit too warm. So then I'll turn it down a little, but they may feel also a little bit of a tingling, or nothing at all. They might just kind of want to, hang out, and it does feel good to them. I've had, positive reactions from that. So I usually use a non-contact probe, meaning the light is delivered and I'm not touching the animal. That's because if I am going over like hips or knees or elbows and there's some like bony prominences there, I don't want to kind of dig deep on those bone regions. And so I do a non-contact probe, just a little bit off the skin, and it gets the same benefits. Other modalities that I use with laser: joint supplements, always, fish oil, Adequan injections, weight loss. That's a big one, but that's a hard one with owners. And also environmental modifications. So if they're slipping on the hardwood floors, you can put booties or like a yoga mat down or other mats down, just so that they can have a really good grip on the hardwood floors. And also acupuncture, chiropractic therapy, physical therapy, and massage. Those are all wonderful tools to use with the laser therapy. So, and I'll try and show you another picture. Again, I so apologize for this, but this is little Cricket. She, her mom wanted just to keep her healthy. I had treated their other dog. So, and so what we're working on here is her back, and I'm using this non-contact probe right here. So I'm a little bit off the skin, and she's just hanging out, and she's in her bed and she's comfortable. And yeah, she is being treated by me. I have my eye goggles on, she has hers on. But it's been great for the little animals, especially that like don't always love the acupuncture needles. So yeah, that's it. Again, I apologize for my lack of slides. I'm happy to send them to whomever wants them after this. And yeah, if anybody has any questions too, you can find me at balancedpetvet.com or info@balancedpetvet.com is my email.
That was fantastic. Thank you, Tori. I'm so sorry that you were having issues of all the days and the times, but you did great.
I know, yeah.
So if anybody has any questions for Tori specifically about the cold laser, put that down below under Ask a Question. I have a question. Is it only veterinarians that are certified or licensed to use that cold laser equipment?
Not in California. So there are lower level lasers, like class 1s, that owners can actually use, but they have to get it through their veterinarian. So the laser machines can only be bought by like a veterinarian or a company, essentially. So a layman couldn't purchase one, but you can get trained in it. A lot of technicians get trained in it. And so if animals are coming in, 3-4 times a week. A technician can go in, they know the protocol, they can get the laser done, and the owners can be in and out. A couple of owners two of my clients do have that low level laser, and so they're treating their animal the days that I'm not able to be there, or if they're having a tough day, they'll treat their animal. But again, it takes a little bit longer time, and you need more frequent application versus the higher class lasers.
Okay. And do most of your patients, is this ongoing with cold laser? Is this something that they would expect to use for the rest of their lives, or is it just getting their injury fixed?
Yeah, it depends. A lot of my clients are older arthritic dogs, and they're geriatric. So yes, I will use it for the rest of their lives. But a lot of my post-op patients, I see them 1 to 2 times a week for probably a month, and then we try and space it out. Okay, let's just see you once a week. Let's just see you every other week. And so I try to get them on a good regimen, and then maybe see them once a month or every 6 weeks. So again, it's case dependent. Again, post-op, we usually can get them up and running, and I don't have to see them. But the geriatric dogs, they love it for life.
Yes. Okay, cool. Well, I don't see any other questions, but don't worry, everyone. We're going to bring all the docs together at the end and have an open forum. So if you have questions then, back for Tori, she can answer those. And I'm going to go ahead and put in the comments her website so that you can find her. And she does more than just cold lasers, so check her out. And she's a mobile vet in the Los Angeles area, correct?
Yes, Los Angeles and San Diego.
There you go. She gets around.
Yeah.
Cool. All right. Well, thank you, Dr. Tori, for that informative information about the cold laser therapy. So we are next. I'm going to take you off of screen, and we're going to bring Dr. Katie Woodley on to talk about acupuncture. But Tori, you're going to stay with us so that I'll bring you back. So I'm just going to take you off screen. Okay. And now we are going to bring Dr. Katie. All right. There she is.
Hi.
Katie, we are so excited to get your take on why acupuncture benefits dogs with pain issues. Can you first introduce yourself and tell us how long you've been treating with acupuncture?
Definitely. And I have a slide too, so you guys are going to get double. So,
girl.
yeah, so I'm Dr. Katie Woodley. So excited to be here, Krista. Love what you're doing. So I have been a veterinarian for 10 years now and treating with acupuncture for 6 years. And it has been a game changer in my practice. So let me share my slides. Hopefully this will work and we'll go from there. All right, perfect. Okay. So we're going to be talking about acupuncture in dogs and how amazing this modality is. Okay, so myself, a little bit more information. I'm actually a Colorado native and went to Notre Dame for my undergrad and then traveled all the way to New Zealand for vet school and lived there for 7 years, came back to the States and practiced in Colorado Springs. And that's where I started really stumbling upon acupuncture. I was getting patients and finding that the treatment modalities were quite limited with conventional medicine. And I was like, there's got to be something more. So I became acupuncture certified and added that in. And it was amazing the results that I gained in my patients. I also do Chinese herbal medicine, Western herbs, supplements, and nutrition and essential oils. So a whole lot of other things. But just a basic thing, like I'm in Fort Collins, but I love connecting with owners across the world, especially if they don't have holistic practitioners in their area and they're looking for more, because my mission is to create healthier pets and happier pet parents through holistic medicine, regardless of location. So I wanted to start with a case. This is Zeus, and he was my very first acupuncture patient. And he came to me with severe neck pain. This poor dog was on like 5 different pain medications, did not touch the level of pain he had. And his poor pet parents were thinking like, this is it. We can't control this. We're going to have to put him down. And I was like, I was just certified with acupuncture. Let's just give it a try. And he made me a believer. And if I knew what I knew now, I would have videotaped this, because he was truly a miracle. And I'm so blessed to have him as my first case. He came in, laid down on the bed. We put the needles in. He just laid there the whole time, stretched out after we put the needles in, and then jumped up and started running around the room. So excited, felt so great. And I just will never forget the look on his like pet parent's face. And I was like, this is going to work. And he ended up living for another 2.5 years and developed some heart issues and other things completely unrelated to his neck pain. And it's because of acupuncture that he was able to gain 2.5 more years of quality life. So I'm going to talk a little bit about the history of acupuncture, what it is, some of the uses, what are the frequency of treatments. There's some variations of acupuncture that are out there, and then some resources that you can go to look up more things for acupuncture and finding a veterinarian that's near you. Acupuncture has been around forever. It's actually one of the oldest medical treatments in existence. It originated in China more than 5,000 years ago. So incredible. The earliest acupuncturists actually used needles made from stone and bone. So we've come a long way. Don't worry, we're not going to use that on your pets. But it became more popular in the 1970s in the US for people. And it's just boomed in popularity for pets for treating pain and chronic illness. So those little needles, they're not bone, they're not stone. So your pet barely feels them, but we'll talk a little bit about that further on. So how exactly does acupuncture work? The goal is always to help the body heal itself. Our bodies are incredible, whether we're talking about pets or people. We have everything we need to heal ourselves. And so if we provide the right tools, we can help it. And so what are these acupuncture needles doing? It's actually enhancing blood circulation, nervous system stimulation, and it's releasing anti-inflammatory, feel-good, and pain-relieving hormones. When we put the little needles in, we're putting them in areas where nerve bundles and blood vessels come together. And we call that acupuncture points. These are all over the body surface when we're talking about Chinese medicine, they're called meridians. These are the energy channels. So we talk about qi and energy moving through these meridians. Those needles are opening up those energy channels. When we're talking about it from a conventional medicine standpoint, we're actually increasing blood flow, we're relaxing the muscles, we're stimulating the nervous system to produce its own natural opioids, which are pain medicine, so that they feel better. They also produce endorphins, which makes them more relaxed and feel really good. So what can acupuncture do for your dog? As I mentioned, it's going to help those muscles relax where we put the needles in. And then also when we're using more distant locations, we're creating different results and effects. So we have a local and then we have a generalized pain relieving effect. So if we're focusing on a really painful area, we can actually use points that are further away to help open up those channels, but also relax those muscles, increase blood flow, and then stimulate the body to produce those hormones and those chemicals to help heal the body. It improves tissue blood flow, oxygenation, and removal of metabolic wastes and toxins. This might sound really familiar with Dr. Courtney's talk. Like, this is very similar to laser therapy. We're increasing the blood flow. We're helping the body heal itself. And the nice thing with this is, unlike prescription and over-the-counter pain meds, it doesn't have those adverse side effects. The worst thing that can happen with acupuncture usually is that it doesn't work. So your pets, if they're on pain medications or other supplements or other medications for chronic illness or whatever they're being treated for, they're not going to adversely interact when we use acupuncture treatments. So we can use it safely to complement conventional medicine and improve the efficacy of treating chronic illness and other diseases. These two are my Spunky, Levi, and Casey. And I wanted to use them because they showcase how we can use acupuncture in so many different ways. Commonly, we use it for osteoarthritis, so pain control. But Levi and both Casey have liver conditions. We can treat it to support the liver, support the immune system. And Casey has asthma and heart issues coupled with congestive heart failure. So there's all sorts of things going on there. And we can use this to stimulate and help improve blood flow, reduce inflammation. And it has been instrumental alongside herbal medicine in these two care and keeping them feeling amazing. Casey is going to be 16 years old and was told years ago that he only had months to live. And through acupuncture, laser therapy, and herbal medicine, he's thriving. So what are some of these uses for acupuncture? Arthritis is probably the number one reason why we're going to use acupuncture. So this can happen at any stage. Unfortunately, we see younger pups that have hip dysplasia and other problems, or elbow dysplasia, because they're born that way. They're born with these congenital issues. And so we can use acupuncture to keep them feeling good, help reduce that inflammation, and get their body to produce natural pain control. Also, degenerative joint disease. So this is the progression of arthritis, where those joint surfaces we're losing the cartilage, we're getting bone on bone. It's leading to more pain, more inflammation. So we can actually use acupuncture to help that. Trauma, so surgery, car accidents, animal fights, tearing a knee ligament. These are all forms of trauma that create inflammation and pain. And we can utilize acupuncture to help reduce that and get pets better faster. So that's where rehab after knee surgery is instrumental to getting your pet feeling their best. And hopefully, if it is a knee surgery, from tearing that other knee. Cancer, this is a really uncommon use in conventional medicine for acupuncture. However, there are anti-nausea points that we can use. So if your pet's going through chemotherapy, we can reduce nausea. We can help their appetite. We stimulate the immune system in a positive, gentle manner so that they're stronger and they're going to tolerate that chemotherapy much better. And then the really neat thing that we can use acupuncture for is for metabolic disease. So if a pet has kidney or liver failure, there's actually points that are correlated to those organ systems where we can utilize them and stimulate that. So we're helping those organs, we're reducing inflammation, we're helping the immune system. So you can see the general theme of how these acupuncture points work in the body. So, okay, that sounds great, right? But how often do you have to take your pet in for these treatments? Usually, if this is the first time your pet is getting an acupuncture treatment, they need to go in more frequently. And then, so that's typically 1 or 2, even sometimes 3 times for that first week. And then what we do is, as we're modulating, so we're changing that immune system, then we can start decreasing those sessions. So you're getting more space in between. The goal is always to achieve the greatest duration of time where that pet's condition appears improved or has resolved. So the effects of treatment are cumulative. So keeping consistency is more beneficial than doing intermittent treatments. I usually tell pet parents that, give it at least 4 to 6 treatments before you say, no, this isn't working. Because I've seen pets respond like Zeus immediately after the first treatment. But then I've also seen pets respond to that 6th or 7th treatment and they excel. And if that person had decided, no, this isn't working, we would have missed out on one more treatment being the key to unlocking their body fixing itself. So keep that in mind when you're setting your schedule up for these acupuncture treatments. You need to be open-minded for, okay, this might take 4 to 6 treatments. Let's go with that, see how they do, because there are some non-responders, but definitely give it a few sessions to really see if your pet's going to respond to them. This is my dog. He is a hot mess on paper, and you can see all of those things that he has wrong with him. And so he has osteoarthritis. He's an 11-and-a-half-year-old German Shepherd. Of course, they can have major issues. Some do great. Mine did not. He has 2 torn cruciate ligaments. We have not had to do surgery on either of his knees. he has what we call lumbosacral disease, which is common in German Shepherds. So that's where they have osteoarthritis of the lower part of their back, which has led to what we call neurogenic bladder. So if his bladder gets too full, he can't pee. I cannot manually express it. I have to catheterize him. And then 10 months ago, he started having seizures and he has a brain tumor. So no good things, right? However, when you meet Finn, you would never know he has any of these things other than just being an older German Shepherd because of acupuncture. When I said Zeus was my first acupuncture patient, I meant Finn because, of course, I came home from my course and I put needles in him immediately. And he's an amazing animal and very tolerant, and he's wonderful. So he's been getting acupuncture for 6 years now. And so by tweaking his treatment plan and changing different protocols and different points that we use, of course, adding in herbal medicine and other supplements has been key. However, acupuncture has been instrumental in him feeling good and not looking like he's sick. And he's 11 and a half years old, which is great for a German Shepherd without any of these issues. So, of course, the number one question we get asked, does this hurt my pet? Most dogs actually don't mind it. Yes, some of those smaller dogs that are more anxious, so like a Jack Russell Terrier or some of those really high energy breeds, they're not going to let us put needles in them, or they're too sore. That's where we use laser therapy. First, we get those muscles relaxed. We help them rehab a little bit, and then we can always transition to acupuncture. A lot of these dogs are actually going to go to sleep after needles are placed, or they get really relaxed. And that's because those needles are producing endorphins. So endorphins are the things that cause the hormones that cause us to relax. So I use frozen baby food because it's a nice positive reinforcement for them. They are happy, they go to sleep. Those sessions are going to last anywhere between 10 to 30 minutes. I've had older pets where I leave the needles in. I do a couple points, leave those needles in for a couple minutes because they respond so well that if I left them in longer, they would probably sleep for 2 days. And every session is individualized. So we're going to look at each patient and make sure that we're using the points that work the best for them. So what are some of the variations of acupuncture treatment? So there's electroacupuncture. This is the most common, and this is that picture in the top that you can see. This is where we connect electrodes to the needles, and we send a little electrical current through those needles. This is going to move chi or energy faster. It clears those pathways, and it's going to stimulate a little bit stronger. So we use this for patients that tend to be a little bit stronger. We're not going to use it across like a tumor or cancerous growth, but it can provide a really beneficial stimulation, especially for those dogs that have like paralysis or decreased sensation in their lower limbs. We can put little needles into their toes and we can hook them up to this electroacupuncture unit and stimulate them a little bit stronger than we would if we were just using needles by itself. There's also aquapuncture where people may inject small amounts of vitamin B12 or saline to stimulate those points a little bit stronger. Laser acupuncture. So everything that was just discussed, we're using laser therapy at those acupuncture points to stimulate those points to get a similar benefit for those pets that don't tolerate needles. Moxibustion is another thing in the Chinese medicine world, and that's that lower picture where we're kind of stimulating that point by heating it up. And so that's not necessarily a very common technique, but you may come across that. And then, of course, what pet parents can do, technicians can do, things that you can do at home, acupressure, or pets that don't tolerate needles, you can apply gentle pressure to these points to stimulate them for the same reasons that we would place a needle. So some of the resources that I want you to be aware of, because veterinarians, acupuncture has to be performed by a trained veterinarian. Make sure you ask your vet because they may actually be certified to do this procedure, or they can refer you to someone that can if they can't. So the different areas you can check for certified vets include International Veterinary Acupuncture Society, the Chi Institute, the College of Integrative Therapies, or CIVT, and then the American Holistic Veterinary Medical Association. If you go to their websites, you'll see what vets are registered that are certified to practice acupuncture, and you can look them up and reach out to them if you feel like your pet's going to benefit from these services. I can tell you right now, almost every single condition can actually be benefited by acupuncture, but there's a lot of different things that we can utilize together. So laser therapy, acupuncture, herbal medicine, nutrition, supplements, there's all sorts of things outside of conventional medicine that can be integrated with conventional medicine to make them more effective. So I'm going to end with acupuncture can help with our pets' health. There's so many uses to keep our pets feeling amazing, keep them happy, healthy, so that you're not worried that you're just watching them suffer and degrade and not feel good. So you can find me at thenaturalpetdoctor.com. We have a weekly newsletter with free tips to help your pets thrive. Check us out on Facebook, Instagram, and YouTube. We provide a lot of free content and tips and fun facts about pets. And I love sharing photos about Finn's journey because he has taught me a lot about how amazing holistic medicine can be to integrate in with conventional. So I'm going to stop sharing my screen and see if there's any questions.
Yeah. So again, if you guys want to go to the bottom middle there, ask a question. We don't have any so far, but Dr. Katie, are there any, what am I trying to say, side effects that a dog could have getting acupuncture?
So what's great is it's pretty safe. So there's a small risk of the needles causing like a bacterial infection, like locally when we place them. I've never had that in 6 years. It's very low risk. That's why having a certified veterinarian place those needles is key. So that way we know where to place them, especially when you're using needles along the ribs and where the lungs are. We need to know how far to place those needles and make sure that we're not causing more harm than good by using this treatment. So very, very low risk, which is great with this. As I mentioned, there are some pets that just don't tolerate needles. So that's where laser therapy and other modalities are great to implement. So we know that pretty quickly if the pet's not going to tolerate it.
Right. And what does a typical acupuncture treatment cost?
Yeah, great question. So typically for a session, it's going to vary between where, like location where you're at. So you can expect to pay between $50 to, I would say, $150 for a session. And then it just varies based on if they're integrating other modalities, other treatment options. Sometimes we add in supplements and other recommendations to help benefit that pet.
Right. And I love when you ladies are sharing success stories. That makes it so real. So thank you for doing that.
Of course.
If nobody has a question right now, we are going to move on, and I am going to get rid of Dr.
Sounds good. You're out of here.
You're out of here. So we're going to stop screen on her, and then we are going to bring up Dr. Alicia Barnes, who's going to bring us in the know of chiropractic for your dog, which I'm really excited. So I am inviting Dr. Barnes on, and she will be up. There she is.
Hi, everyone. Hi, Krista.
Hello, Dr. Alicia. Thanks for coming on.
Of course.
I'm so
Thank you so much
excited
for
to
having
learn
me.
more. This is going to be great. So if you wouldn't mind introducing yourself and tell us, why did you decide to go into this field?
Yeah. So I am Dr. Alicia Barnes. So I'm a chiropractic doctor. And originally I had, let me see if I can even share my screen. Have a little slides for you too. So if you guys are just patient with me for a second here while I pull that up. All right. All right, and there we go. Perfect. Thank you guys for being patient. And let's see. And we should have our little PowerPoint. All right. Maybe I'm with Dr. Tori and
Dr. Alicia,
having,
you just need to go to whatever tab your PowerPoint is. If you go, we're looking at your screen, so all your tabs at
yeah.
the top.
Okay. I have my PowerPoint on the bottom here. Maybe I'll be with Dr. Tori and maybe I'll try again here. So yeah, so I'm Dr. Alicia Barnes. I'm a chiropractic doctor. I am from Fort Collins, Colorado. Went to Colorado State University originally, actually for pre-vet. Thought I wanted to go to veterinary school, and then just realized I really wanted to work and treat people as well, and loved kind of the holistic approach of chiropractic care. So got my doctorate in chiropractic in Portland, Oregon, and then got certified in animal chiropractic in Dallas, Texas. So I've been in practice for about 9 years now. I'm treating both people and animals, and now have a full-time practice in Northern Colorado, working primarily with dogs and cats, and it's been so fun. So the premise of chiropractic care is really to focus on joint motion, nervous system function, and overall alignment and conformation. So our job as chiropractors is to assess how the joints are moving, if they're moving properly, if they have full range of motion, and then if there's any pain response or any neurological decline, because especially the vertebral column, so along the spine, if the joints aren't moving properly, it can affect what's called your afferent or your efferent neurons. So those are sending sensation signals to the brain, so telling the body or telling the brain what the body is feeling, and then efferent are sending motor signals back to the body. So when there's interference there due to improper motion, it can affect everything from digestion to immune function to pain and stiffness, and then also just a lack of motion and increased chance of injury. And so let me try one more time and see if I can share. And again, thank you for your patience. Maybe I'll try sharing my entire screen and then just share my PowerPoint. Let's see here. Yeah, can you guys see that?
We still see you.
Still see me. Okay.
Yes.
All right.
First time you did it, at least we saw your screen.
Okay.
Something's happened. There we go.
There we go. Do you guys see that now?
Yay!
Yay. Okay. Well, I'm not as good as Dr. Katie because I don't know if you can still see my face.
Yes, you're down in
Oh,
the
you can.
Yes.
Okay, perfect. Thank you guys for your patience. So again, kind of just about me. So I am certified through the American Veterinary Chiropractic Association. And that's what you really want to look for. So you either want to have animal chiropractic performed by a veterinarian that's certified in animal chiropractic or a chiropractor that's certified in animal chiropractic, but you want to make sure that they have that AVCA certification because that really is the epitome of training in this field. Chiropractic is very safe, but you just want to make sure you're working with people who know what they're doing, who've been in practice with animals and or have trained to work specifically with them. So my little joke and on my shirt, but it's so true. I love animals so much. It's really why I got into this genre. Dogs and cats and horses and all furry creatures tend to give us so much joy. And it's just my pleasure to be able to help their little bodies be as happy and healthy as possible. And I want to give a shout out to Dr. Tori and Dr. Katie because an integrated approach with laser and acupuncture and nutrition and rehab is really just magic for these animals, increasing quality of life, reducing pain and stiffness, increasing overall wellness is just huge when you can start using some of these natural approaches and really just help your animals thrive. So I first started chiropractic with my own dog at about 2 years of age. She was diagnosed with hip dysplasia and was really already starting to display pain and soreness. And of course, had her evaluated by her veterinarian, recommended pain medication, but I knew that, I wanted to do more for her than just that, especially, wanting to make sure she lived as long as she could. And so that's when I started bringing on these other therapies, of course, chiropractic, massage, and acupuncture with her. And she lived to be 15. She did wonderfully. And so these therapies are just incredible, even if dogs, have conditions that may not, not necessarily be cured, but we can really help improve their quality of life. So the focus of chiropractic care is we want to look at alignment, joint motion, nervous system function, muscle tension, and then pain management. So those are kind of the things that we are trying to assess, trying to evaluate, and then trying to help treat or improve if we can. So this dog's named Buddy, and Buddy had, unfortunately, 2 failed knee surgeries. He could barely walk, so he needed to have 2 repairs done, so 2 more surgeries on his knees, and then, of course, had a lot of back pain as a result. So while he was getting rehab for his knees, we also started incorporating chiropractic care just to help with his back pain because his gait had changed from those surgeries. And Buddy's been a lifelong patient now. His owners report that he moves better when he gets adjusted. He's happier. He has less pain and soreness. And his rehab just tends to go a lot easier once his back is in alignment and pelvis is in alignment. So the benefits of chiropractic care are reduced pain and stiffness. If anyone has ever broken a bone and you've had your elbow in a cast, you know that when that cast comes off, how stiff your elbow is. And that's because all the synovial fluid in that joint, or the fluid in that joint, has thickened up. And, in chiropractic, we say motion is lotion. We need those joints to move in order to bring in new nutrients to the joints and then flush out debris. And when we don't have that motion in the joints, we tend to get pain and stiffness. So that's where adjusting can really help reduce that. Decreased muscle tension is a benefit of chiropractic adjustments, and that is due to the effect on the mechanoreceptors in the joint. So those are sense organs that are taking in stimulus and transmitting that to the brain and then monitoring tension in the muscle. So when we're able to adjust a joint, we're able to give a temporary relief to the strain in the muscle, and it reduces the tightness. And then, of course, improved overall nervous system function, which can aid everything from digestion to immune function. And again, that's because of the effect of lack of motion on the vertebral column. So when joints aren't moving properly in the back, it can affect the spinal cord and then the nerve roots that are exiting that, which are supplying the organs. There is a reflex called the H reflex, which you can look up, and that's been shown in studies to be improved after chiropractic adjustments. And again, so it's just helping the nervous system to communicate to the organs, muscles, ligaments, tendons, that for allowing for motion or allowing for organ function. So care is safe, effective, and gentle for those that are not familiar with chiropractic care, or maybe you've had adjustments yourself. I think every owner is so worried there's going to be this, rough popping or twisting, and it's not like that at all. It's very, very kind and gentle. Many times I'm just using my fingertips to adjust. And it's similar to the way we adjust children and babies. So it's very calm. The dogs really enjoy it. This is Yogi, and he is in for just pain management due to arthritis. So he has a lot of arthritic change in his lumbar spine, has a lot of pain as a result, but he gets laser, acupuncture, and chiropractic, all to kind of help keep him mobile, keep as much strength in his back legs as we can, and then, of course, reduce his pain. So how do adjustments work? So like I said, they affect the mechanoreceptors in the joint. So those are kind of sense organs that are communicating to the brain, improving afferent and efferent neuron function. So again, sensory and motor function, and then reducing abnormal forces on joints, muscles, ligaments, tendons, and bones. So this kind of is the physics of chiropractic. When we have abnormal alignment, it increases wear and tear on those soft tissues. So they become more injured, more inflamed, and then more predisposed to more serious or catastrophic injury. So if we can improve the alignment and we can improve just normal loading in the joint, we can reduce those abnormal forces and just help the tissues to heal and then to prevent further injury down the road. So how do you know if your dog needs an adjustment? So these are quick screens. You can ask your dog to sit and just look for any asymmetries. And there can be multiple reasons why your dog may be sitting funny. It could be knee pain, hip pain, back pain, pelvic misalignment. So that's why you want to make sure you're going to someone who can identify when those are more veterinary related issues and your dog needs to see the vet, or when it's a chiropractic issue. So cookie stretches, you'll ask your dog to sit and then take a treat to both shoulder, and you're just looking for range of motion in the neck. And again, this is just a quick screen checking for any abnormalities or asymmetries. If you see they have trouble turning to one side, it could be due to tight muscles, it could be due to cervical restriction, shoulder pain, things like that. Posture, again, just looking for anything that looks a little funny. So is their head tilted to one side? Are they roaching in their back? Looking at their top line, anything that looks out of the ordinary or just doesn't look right. And then a spinal screen. So you can run your fingers along your dog's spine and just you want to look for any kind of twitching of the muscles. That can just indicate that there's some pain, there's some soreness, there's some tightness going on. And again, these could all be caused by different things. So you want to make sure that they're getting, when you take your dog in, that you're just getting an evaluation to determine what the cause is, if it's a chiropractic related issue, or if it's more of a veterinary related issue and needs to be seen by your vet. So the benefits of chiropractic care is reduced pain, reduced stiffness, improved sports performance. So I see a lot of agility dogs, police dogs, hunting dogs, and that we're just really wanting to make sure that their bodies are moving well, like Olympic athletes or any athlete, that a lot of them get chiropractic care to just improve their overall performance, improve their range of motion. And then the next part is reduce their risk of injury. And we just discussed that with the abnormal wear and tear on the soft tissues. I do see a lot of show dogs, and we're working on confirmation because if they do have lack of range of motion in their spine, it can affect their gait. If they have tightness in their neck, it can affect how they're holding their head. And then, of course, any lack of motion in their shoulders can just affect their stride length. So getting adjusted before shows is a popular thing, just to make sure that their bodies are moving properly. Reduce stiffness, and then improved quality of life. So if we can help with circulation and overall nervous system function, that kind of leaks into all aspects of their wellness. And we can just kind of help them be as happy and healthy as possible. So I just wanted to thank you guys. Thanks for being patient with me as I figured out my screen sharing. Thank you for that. And I just want to give a little shout out to all the owners that are seeking these natural approaches. You guys just love your pets so much, and it shows. And the fact that you're wanting to do the best for them and bring in other therapies just to help them have the best life possible is just so admirable. I feel so blessed because I get to work with just the best people. Only the best people want to get their dogs adjusted. And so it's just so wonderful to be able to help these pets and then work with just such amazing people. So I'll stop sharing here and see if we can bounce back.
Thank you, Dr. Alicia. That was
You're
awesome.
welcome.
A lot of stuff I didn't know.
Thanks for your patience.
Oh, it was perfect. So again, if anybody has a question, in the bottom there, it says ask a question in the middle. So just put your question in there. Dr. Alicia, when you're doing chiropractic work, is it mostly the spine that you focus on, or do you also do legs and paws?
Yep.
And
So both. So I adjust extremities and the spine. The main focus is the spine, but we look at every joint, any synovial joint, which is just the ones that have synovial fluid, so shoulders, elbows, knees, and then just it depends what's going on if those joints need to be adjusted or not.
And how long is a typical session?
Yeah, so I reserve about 30 minutes because I like to work really slow and let the dogs get really comfortable. I'll also do some massage and soft tissue work just to kind of help ease discomfort. But yeah, adjustments typically last anywhere from 10 to 20 minutes. And then I'll incorporate some soft tissue work as well.
Okay. And I did put in the comments section your URL.
Perfect.
So
Thank
if people
you.
want to learn more about Dr. Alicia and what she does, please check her out. If somebody's looking for a chiropractor in their area, are there resources where they can go and find?
Yes, I will post the website. You want to go to the American Veterinary Chiropractic Association website, and I'll post that in the comments
Okay.
because that's where you can find a doctor who's certified by that organization, and you can search by state.
Perfect.
Yeah.
All right. Well, thank you.
You're
Now, I am
welcome.
going to re-invite Dr. Tori and Dr. Katie up to see if anybody has any more questions. So here is Dr. Tori, and now I'm inviting Dr. Katie. All right. There's Dr. Katie. And I know Dr. Tori's been having issues, but there she is. Yay. Well, ladies, thank you. That was amazing. I have a couple of questions. If we can go back to pain, what are signs of pain? Since dogs can't talk, what should we be looking for? You know, obviously limping would be a sure sign, but do you ladies have any other suggestions on how we can identify pain in our dogs?
Yeah, slowing down on walks, hesitating to jump up like in cars or couches, or just kind of like that hesitation to jump up or not wanting to jump up. A lot of times if they have like neck pain, not wanting to eat or drink, so not wanting to bend down to their food or water bowls. Again, slowing down on walks, that type of thing. Anyone
Anybody
else?
That sound good? Anybody want to talk about the usual pain meds that usual veterinarians are prescribing and the effect of the liver and the kidneys? And I just have to commend all of you for what you do with a holistic approach where you're looking at the root of the pain, and let's address that as opposed to just throwing NSAIDs at them. Does anybody want to talk to that? What those do to the body?
I'll talk about it. So there is a time and a place, of course, for conventional. So I'll start with that. A lot of pets that are in severe pain, we do usually have to use something to reduce that pain. However, by integrating, holistic methods like we all do, we're able to get them off if they're on a pain medication or get them to a minimal amount. The biggest thing, especially with like non-steroidals, so that's like Rimadyl or Carprofen, is we're worried about liver and kidney problems over the long term and affecting, so like the gastrointestinal upset, causing ulcers and diarrhea and all sorts of things like that is the most common thing that I see. And that's where using herbal medicine and then integrating acupuncture, laser therapy, and chiropractic is huge. It works so well. But the hard thing is it can take longer. And that's what I always tell like pet parents is that, when you're giving a drug, you're blocking a receptor, you usually see a response within a few hours, and we're used to that immediate response. And so when we're using some of these other alternative modalities, it can take a little bit longer because we're working on the root cause and changing the body. So that's the biggest thing that can be hard for people to see and like give that time to take effect and to really work. So that's where it's nice to be able to use some of these conventional meds while we're using these other alternative modalities to heal the underlying cause or to help it so that they don't have to stay on those stronger medications that can potentially cause harm.
And reduce the inflammation. I'm sure
Yes.
you're doing
Yep.
your work. That makes sense. Okay. Anybody else have anything to chime in on that?
No, that was great. Yeah, I agree with that.
Okay. Anybody else have any questions while we have these experts right here? Oh my gosh, this is awesome. Anybody else before we wrap things up? Going once. Okay, well, I would love to hear from people in the comments. Just what is your feedback from this webinar? If you could let us know, did you find value? Is there one thing that you learned today or a takeaway that you're going to implement? Are you going to have your dog have a chiropractic adjustment or try cold laser or acupuncture? We'd love to hear from you to make sure that we are providing the most value for you guys. Ladies, we are so grateful for you to share all of this information, and it's great to know that there are other options out there that are available that could be used instead of or maybe in addition to the usual pain medications. And again, in the chat, thank you, Kelly. Kelly says it's very informative, and she's planning to add cold laser to her dog massage practice. That is awesome. Yay. Well, if you have any questions about the cold laser, please reach out to Dr. Tori. And I know Dr. Katie also uses cold laser as well, so she could probably speak to that. Is that correct?
I can refer them to people.
Okay.
I actually don't have laser, but I used to use it at my practice before I started my own thing.
Great. All right. Well, again, a big thank you to our panel of experts. And thank you to everybody here watching this, because you are being proactive, as Dr. Alicia mentioned, in your dog's health and happiness. So yay, you guys are awesome dog parents. Everyone might notice on the bottom of your screen, there's a green button, and it says the first aid sign up button. And that is our free webinar for next month. We are going to be focusing on first aid and safety. So we're going to have a webinar on April 16th on first aid with Arden Moore. And if you have not heard of Arden Moore, she is America's pet health and safety coach and a best-selling author, master certified first aid instructor. She has a show on Pet Life Radio called Oh Behave, which is actually one of Oprah Winfrey's favorites. So I just wanted to let you guys know about it, and we're doing some great stuff here. So if you would like to attend that, please sign up, click the button, invite your friends, because space is limited. And I hope everybody learned something new today. At WAG Out Loud, we want to make it easy for you to implement and just go through all of the information out there. There's a lot of it. So that is what we're here to do, is to help inform so that you can make the best decisions for your dogs. And if you're interested in a replay of this webinar, it's going to be at the same link. So a cool feature is that you can go to anywhere in the replay. If we had questions asked, you would just click on that question and it takes you right to the question when it's answered in the broadcast. So that really is cool. All right, so it's dinner time for everybody. So thank you everyone for being here. I really appreciate all of you, and I wish you a tail wagging day.
Thank you.
Thanks, Krista.
Thank you. Thanks, everyone.
everyone.
Everybody.